Welcome to Dental Hive Dental Reception Basics. In this series of resources, we will present topics that provide the foundations for working as a dental receptionist in Canada. These resources are intended to help onboard new dental receptionists and also act as a refresher for current team members. Today, we are discussing dental insurance breakdowns. Regardless of how your clinic bills to insurance, we find it very helpful to know what our patient's insurance covers, and this knowledge can help us treatment plan and improve case acceptances. Depending on the insurance company, you may be able to call directly, log into their site, or you may need the member to call and give permission prior to obtaining policy information. Before getting started, make sure you're prepared. Some insurance companies may require the dentist's unique number or your clinic's office number. You might also need the patient's name, date of birth, insurance policy or group number, as well as their certificate or ID number. Now onto the breakdown form. At the top here, you want to include the insurance company's name and whether this policy is the patient's primary or secondary insurance. If the policy belongs to someone else other than the patient, include the policyholder's name, date of birth, and what their relationship is. Is the patient a partner, spouse, child, etc.? What is the policy year for the insurance? Here, you would write what the benefit year is or if it's a calendar year. Does the plan follow the current provincial fee guide, or is there a lag? Does the policy include a deductible, and what is the individual and family deductible, if applicable? Specialists have a different fee guide, so it's important to find out if the plan has specialist coverage. Next, we need to find out the annual dollar amount for this policy. Does it combine basic and major procedures? If the plan has separate maximums, you can indicate coverage for each service, including what percentage the procedures are covered at and what is the dollar max. If the plan has orthodontic coverage, it may be likely that the dollar maximum is for a patient's lifetime, or you may see an age restriction. Next, we move into frequencies. How many scaling units does the plan have? Include root planing units if combined. What frequency is the recall, polish, and fluoride on, and are there any age restrictions? You can note on the lower left side children's changes to limits or frequencies at the bottom. How often is comprehensive exams, PANS, or full mouth series covered? Are 4 bite wings allowed or only 2? For hygiene, you also want to inquire about OHI, which is oral hygiene instruction. Lastly, use the rest of the spots to make individual notes. Are scaling units on rolling month frequency, which will differ from the policy year? If unsure about rolling months, see our calendar year versus benefit year versus rolling sums resource. Also, some policies may have exam frequencies. For instance, all your exams have to be spaced out by 5 months, regardless if it's a recall, specific, or emergency exam. Any final notes can be made on the bottom right side, and they might include composite on molar information or different percentages for perio and endo procedures. Thank you for listening. We hope you've learned some helpful pearls. Make sure to check back regularly for new resources and features.